Let's open to the back.
Nobody wants to get an infection while recovering from a serious illness in the hospital, but it happens. Hospital-acquired infections are a major healthcare problem nationwide.
We know that patients who are hospitalized now are a lot sicker than they used to be. They're often on medications to suppress their immune systems. They often have a lot of invasive medical devices, things like catheters in their bladder or lines or catheters in their bloodstream, all of those which are risk factors for development of infections.
According to the CDC, as many as 1 in 25 patients acquire infections while in the hospital, resulting in more than 75,000 deaths nationwide each year. The prevalence of so-called superbugs is also to blame.
A superbug is a bacteria that is resistant to some or all of the antibiotics we would normally use to treat that. And sometimes they're not necessarily more dangerous, they're just less treatable. So the overuse of antibiotics and the intensive and prolonged use of them have resulted in bacteria for which we have limited treatment options. All of that is kind of a perfect storm for patients to develop infections while in the hospital.
To combat the problem, UCLA has launched one of the most comprehensive infection prevention programs of any hospital in the country. Patient rooms are cleaned multiple times a day, and it's very thorough. High-touch surfaces are spot-checked with a unique glow marker. If the mark shows up under a black light after cleaning, it's a teaching moment for the staff that those areas are being missed.
When those are effectively removed, we know that they use the proper friction and cleaning technique to prepare that room.
UCLA is one of the first hospitals to use this compact mobile device that packs a powerful punch.
We're actually using a new ultraviolet robot. It's called the Xenex, X-E-N-E-X, that is pushed into the patient's room after they're discharged and basically bathes the entire room in ultraviolet light, which we know is a potent disinfectant.
Well, I'm very impressed with UCLA with regard to cleanliness and how meticulous they are.
I've never seen anything like it, and I've been in many hospitals.
UCLA has extensive infection protocols for everything from hand washing to placing central lines used to deliver medications directly into the bloodstream.
It's very similar to an airplane pilot checklist, where we know these are the 10 things that I must do before takeoff to ensure I have a safe flight. It's no different for inserting a central line. We know what type of antiseptic is the best to use, we know the technique that is the best to use, and is now done on insertion for every single central line at UCLA.
UCLA is among the first to develop protocols for deadly infectious diseases like Ebola. And they are looking for ways to make the hospital room itself more resistant to disease.
We're also doing some cutting-edge research on the role of the environment in transmission of hospital infections, including one study where we're actually replacing standard surfaces in the room with copper. And we know that copper is a very potent antibacterial, and it kills bacteria within 30 minutes of contact.
These efforts are paying off at UCLA, which continues to exceed national infection control guidelines to keep patients safe.
I think the message to the patient is that we want UCLA to have the lowest number of infections of anywhere in the country. I'm confident we'll be able to get there.